will invite the next speaker, Chastanet. The topic is the importance of hemodynamics when considering asphalt.
Thank you again. You know that in standing position, the hydrostatic pressure increases from the top to the bottom of the limb and is most important in the lower part of the limb, leading to create dilatation and create a varicose reservoir. And due to the pressure and the filling effect of the varicose reservoir, the dilatation will progress upward to the saphenous trunk. Oops. Okay, so you know also that there are increasing evidences for this ascending evolution theory, where the progression of the disease is from tributaries towards the saphenous trunk. We have seen that this morning. And from this ascending evolution theory, now we have seen different to a new strategy for the treatment, with a treatment focused on varices. This is the other method. The goal is to improve hemodynamics and to help the saphenous vein to recover. But what are the hemodynamic consequences of asphalt on the great saphenous vein? To answer to that question, we did a prospective study, and we studied the effect of isolated phlebectomy on reflux and diameter of the great saphenous vein. So we studied reflux duration, peak reflux velocity, and diameter of the great saphenous vein. And in that population, we have found a significant reduction of the mean reflux duration, a significant reduction of the peak reflux velocity, and you know now the importance of the reflexing volume. Through many studies, we know that there is a correlation between the findings of plethysmography and clinical and duplex improvement, and also a correlation between the volume of the saphenous reflux and the C classification. So for us, the volume of the reflux could be the key point to explain the clinical meaning of a reflux and the effect of the phlebectomies. We have published the result of asphalt at 4 years of follow-up, and our main important conclusion was that the extent of the varicose reservoir ablation, that means the quantity of varices you will ablate, was the key factor determining the hemodynamic and clinical efficacy. And we have some tool to know what will be the varicose reservoir ablation, what you need to do through the number of zones which should be treated. In that diagram you can see it. And also we have a predictive hemodynamic tool for asphalt. We call that the reversibility test. We'll talk about it later on Saturday. But not only hemodynamics are important when considering asphalt, of course. We know the influence of the location of the reflux and varices on recurrences. For example, we have less frequency of private recurrences of reflux when the reflux was located above the knee and when varices were at the thigh or at the upper calf. So in conclusion, I would say that after asphalt, we observed the modification of the reflux in the great saphenous vein, leading to a reduction of the volume of the reflux. The reflexing volume could be the key point, explaining the effect of the ablation of the varicose reservoir on the saphenous vein. The larger the extent of the varicose reservoir ablation is, the better the hemodynamic and clinical results are. But, of course, hemodynamics are not the only determinant to achieve good results considering asphalt. Anatomical and clinical considerations, as well as age and cosmetic concern, should also be taken into account. Thank you very much.
Our next speaker is